Hello, my name is Jacqueline Jankow, and for my innovation project, I'll be talking about an application called Glucose Buddy. I'll be talking about what the problem is and the innovation project, where the problem occurs, who's affected, and what will be different if the problem resolved. And first, we're going to talk about diabetes type 2. So, diabetes is a problem where with your body that causes your blood glucose sugar levels to rise higher than normal. This is called hyperglycemia. Type 2 diabetes is the most common form of diabetes. If you have type 2 diabetes, your body does not use insulin properly. This is called insulin resistance. At first, your pancreas makes extra insulin to make up for it, but over time it isn't able to keep up and can't make enough insulin to keep your blood glucose at normal levels. So when you eat, your food is broken down into a sugar called glucose. Glucose gives your body the energy it needs to work. But to use glucose as energy, your body needs insulin. When you have type 2 diabetes, your body does not make enough insulin or use it well. Since your body's cells can't use glucose from your food as energy, the glucose stays in your body where it can cause serious problems. So who's affected by this disease? So being overweight is a primary risk factor for type 2 diabetes. The more fatty tissue you have, the more resistance your cells become to insulin. However, you don't have to be overweight to develop type 2 diabetes. According to the American Diabetes Association, if your body stores fat primarily in your abdomen, your risk for type 2 diabetes is greater than if your body stores fat elsewhere, such as in your hips and thighs. The less active you are, the greater your risk of type 2 diabetes. Physical activity helps control your weight, uses up glucose as energy, and makes your cells more sensitive to insulin. The risk of type 2 diabetes increases if your parents or siblings have type 2 diabetes. Although it's unclear why, people of certain races including blacks, Hispanics, American Indians, and Asian Americans are more likely to develop type 2 diabetes than whites are. The risk of type 2 diabetes also increases as you get older, especially after age 45. That's probably because people tend to exercise less, lose muscle mass, and gain weight as they age. But type 2 diabetes is also increasing dramatically among children, adolescents, and younger adults. Prediabetes is a condition in which your blood sugar levels is higher than normal, but not high enough to be classified as diabetes. If this is left untreated, prediabetes often progresses to type 2 diabetes. If you develop gestational diabetes when you're pregnant, your risk for developing type 2 diabetes also increases. If you gave birth to a baby weighing more than 9 pounds, you're also at risk for type 2 diabetes. And also, for women having polycystic ovarian syndrome, a common condition characterized by irregular menstrual periods, excess hair growth, and obesity, also increases your risk of diabetes. So, type 2 diabetes can easily be ignored, especially in the early stages when you're feeling fine, but diabetes affects many major organs including your heart, blood vessels, nerves, eyes, and kidneys. Controlling your blood sugar levels can help prevent these complications. Although long-term complications of diabetes develop gradually, they can eventually be disabling or even life-threatening. So that was just some information about diabetes. Now I'll talk about the significance of the problem with statistics, the background, and solutions that have been tried in the past. So there's actually no cure for type 2 diabetes at the moment, but it can be managed. Balancing the food you eat with exercise and medicine, if prescribed, can help your blood glucose in a healthy range. Diabetes is a difficult disease to manage and control because compliance is needed with diet, exercise, weight management, and medications. So, statistics about diabetes. So, in 2015, 30.3 million Americans, or 9.4% of the population, had diabetes. Approximately 1.25 million American children and adults have type 1 diabetes. 1.5 million Americans are diagnosed with diabetes each year. And diabetes remains the 7th leading cause of death in the United States in 2015. As of March 6, 2013, $245 billion is the total cost of diagnosed diabetes in the United States. $176 billion for direct medical costs, and $69 billion is in reduced productivity, which is very expensive. So a healthy lifestyle choice can help prevent diabetes. Even if you have diabetes in your family, diet and exercise can help you prevent the disease. If you've already received a diagnosis of diabetes, you can help use a healthy lifestyle choices and help prevent complications. If you have prediabetes, lifestyle changes can slow or halt the progression of prediabetes to diabetes. So professional literature explains a couple of things that have tried in the past, such as the artificial pancreas device system, which is the picture shown here. It's a device that closely mimics the glucose regulating function of a healthy pancreas. The patient must be very knowledgeable about the use of this device, and that's why it can be ineffective. Patients must be very knowledgeable because the concentration of glucose circulating in the patient's blood is constantly changing. It is affected by the patient's diet, activity level, and how his or her own body metabolizes insulin and other substances. This can be actually very costly, and it may have technical difficulties because it is a device system. Another strategy that has been tried and is still going now is the bariatric surgeries. There are a couple that surgeons use and is usually only considered in adults with a BMI or body mass index above 35 and with other comorbidities such as type 2 diabetes. This surgery may have complications, is very costly, and the outcome may or may not result in weight loss because there's a lot of compliance and there's a annual follow-up visit. So next I'm going to be talking about who I collaborated with on this project proposal. So I chose 3 people: a registered nurse diabetes educator at Providence, a psychologist at Providence, and a medical doctor who specializes in diabetes. So I will talk about why I chose them and what help they offered. So, the registered nurse educator at Providence works with patients on a regular basis and understands the complications and compliance issues. She basically sees patients that come to her office as outpatient for more education, and she also sees patients that are consulted for more education issues. The psychologist at Providence was discussed with because a new study showed that the opportunity for collaboration with another interdisciplinary team member, such as psychologists, helps with diabetes prevention and management. Psychologists are not normally included in a patient's plan of care with this disease, but because the patient's psychological, behavioral, and social contexts are given of equal importance to the biology of this disease, it's really important to include them in helping with the management and control of this disease. A medical doctor that specializes in diabetes is the primary healthcare professional that educates patients on the disease, prescribes medication, and helps with compliance. They work directly with patients on a regular basis and understand the complications and compliance issues that patients may have. So each of them explained that an application for a patient may be difficult for some individuals that are not very good with technology and would not benefit from health applications. The doctor and the nurse thought that having patients keep track of their blood sugars and having the application to show providers help with compliance and help with talking about the information on applications with routine checkups and visits were done. So this also helped with showing if the patients were compliant with checking their daily insulin or blood sugar checks and with their eating habits and their lifestyle activities. The psychologist believes that expertise in selection of psychological assessment and screening tools are needed in the delivery of interventions and promotion of effective treatment. So this is important because we as healthcare professionals need to know exactly who needs the most education and who needs the most resources. So next I will talk about the mobile app that I used and a description of the problem and how to use this application. So Glucose Buddy is an innovation application created in the management of diabetes. With diabetes being a disease that is affected by diet, exercise, and medication compliance, this application is helpful in creating an easy way to track and manage all of that in one place. This application allows the individual to input glucose checks, hemoglobin A1C levels, medications, blood pressures, calorie intake, body weight, and activities into one app. When individuals use this application on a daily basis, the application is then able to calculate averages and compliance. Blood glucose levels that are checked daily are able to calculate into an average, a maximum level, and a minimum level. With all the information inputted into the application, an estimated hemoglobin A1C level is displayed. When individuals are inputting their information into the application, they can view a summary for each day as well as long-term trends. So it's a very, very easy to use app actually, and I believe it will be very easy to educate anybody that wants to use this app, even if they're not very skilled with technology. So I will now talk about how the app and how this innovation was a solution to this disease. So the innovation of technology to improve patient outcomes and clinical practice is fascinating. Johannesson said, "People in the program have managed to connect these fields, and through these connections they have come up with new creative insights. Individuals, teams, or organizations step into the intersection by associating concepts from one field with concepts to another. It amazes me how people have come together to design an application that will help patients easily access and store information to manage and track the progress of a disease." Ventola stated that medical devices and apps are already invaluable tools to the healthcare professionals, and as their features are used and expands, they are expected to become even more widely incorporated into nearly every aspect of clinical practice. McGuire believes that, from a business perspective, a new technology can reduce a business's cost to produce a product or increase a product's value. As future doctorally prepared nurse practitioners, we will be the ones that implement evidence-based practice innovations into the workplace and propose new ideas that will include the use of technology. We need to be able to educate others and our patients and our staffs to somehow get rid of these language barriers or other learning barriers and educate all of our patients effectively in a way that they can understand and be compliant. When the main goal is to improve patient care and outcomes, rigorous evaluation, validation, and the development of best practice standards for medical apps are greatly needed to ensure a fundamental level of quality and safety when these tools and technologies are used. Mobile information technology is playing a huge and important role in healthcare and in the outcome of patients' health. So I'm really proud that this application has been used out there, and I hope that you guys enjoyed my presentation. Here's my references, and thank you so much for listening.